Mr. Speaker, access to a family doctor is essential in rural Nova Scotia. The recent closure of Dr. Ben Boucher's office in Port Hawkesbury has left thousands of patients without a doctor, and the doctors that remain are not accepting new patients. Residents are now asking what the NDP government is doing through the Department of Health to attract new family doctors to the Strait area. My question is, will the Minister of Health advise what efforts are underway in the Department of Health to recruit new doctors to the Strait area?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. And one of the things we've done over the last couple of years is try to strategically invest in primary care clinics. We have done that in the member opposite's area that he represents. We've done it in other areas that we know have been challenged with recruitment and retention of physicians. We never want to hear about a physician leaving the province or leaving practice. We know that leaves a void with many, especially in rural communities, because those practitioners have a large volume of patients. So we're going to continue to work with the District Health Authority to try to ensure that we can get patients access to primary care clinicians. We're going to continue to invest in primary care clinics around the province so that we can attract physicians to those areas, because if you create a good working environment where you provide an environment that's working with collaborative clinicians from different disciplines, then it's more appealing. And I hope with other things that we're doing around training and the residency program that we have in the Valley for general practitioners, that we're going to capture those medical students and get them to stay here in the province, and more importantly, Mr. Speaker, practice in rural communities.
The Honourable Member for Richmond on his first supplementary.
Mr. Speaker, the WB Kingston Memorial Clinic in Lardwise, which services thousands of patients as well, is currently without a physician. Local physicians are coming in 1 day a week, which makes up for 2 days a week, and quickly their days fill up with appointments. The rest of the residents are left to wonder where they will find a family physician, especially since those existing in other communities are not taking new patients. The earlier question I asked is what specifically is the Department of Health doing to attract physicians to rural Nova Scotia? I don't believe we received an answer to that, so allow me to ask the Minister again. Will the Minister tell us the name of the individual or individuals in the Department of Health who are responsible for physician recruitment for doctors in rural Nova Scotia?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and I'd have to disagree with him. I was answering his question. We've done a number of things. I've talked about the residency program that is the first of its kind in the country, that we have 5 medical students now in the Valley practicing in a rural setting. We're going to have another 5 in July, so that'll be a complement of 10 every year going forward. And it's our hope that those individuals who are practicing now in that type of environment will stay in a rural community and not just stay in the Valley, hopefully go to Cape Breton. We've changed the policy of government to invest in smaller primary facilities, Mr. Speaker. We're investing money in his riding to ensure that we have an environment that will attract a physician to come to that area of the province, Mr. Speaker. We have a physician resource plan, something the province has never had in the history of the province, Mr. Speaker, and that gives a snapshot of where we need to work on and who do we need to attract to certain parts of the province. I know there's a lot of interest around the physician resource plan from our medical students at Dalhousie, which is a promising thing, Mr. Speaker, so that we can hopefully get some of those physicians into rural areas, especially in rural Cape Breton.
The Honourable Member for Argyle.
Thank you very much, Mr. Speaker. Thank you.